At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. I'd like to start off each and every week. I'd like to say hello to all our loyal listeners and a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. Of course, if you are new to the show, typically in the first half hour of the show, we typically talk about the very unique and wide variety of treatment options we offer, all under one roof right here at the American Back Centers. Of course, the American Back Centers was started by Dr. Dennis Miskovich almost 50 years ago now. It's going to be 50 years coming next year of American Back Centers being in the local Wexford area. We are just down the street. The building that we were in is now a Ace Hardware building. We moved less than a mile north on Route 19. We're right across the street from formerly Atria's, now Ditka's restaurant, right here in the Stonewood Commons Office Complex, Building 2, Suite 100 at 103 Bradford Road, again in the second building, Building 2, in the Stonewood Commons Office Complex. But in the last 20 years, since 1994, the American Back Centers has specialized in the treatment of very difficult disc-related conditions that many people were not able to help. People with failed back surgery, people with multiple failed back surgeries, people contemplating back surgery, sciatica, stenosis, degenerative disc disease, bulges, herniations, extrusions, some of the worst cases that have been to every doctor known to man, literally, and they come to us hoping for an alternative to the pain medication, the epidurals, the pain shots, failed treatment options, failed physical therapy, in some cases failed chiropractic care, where the chiropractic has helped them for many years, and now that has met a standstill, where the treatment has met its limitation as far as a more severe disc condition, spinal stenosis, bulging, herniated disc, not responding to your current treatment option, whether it's chiropractic or physical therapy, and they need to take a greater step up into an FDA-approved procedure specifically for these type of problems. Since 1994, as I mentioned, Dr. Miskovich saw the groundbreaking research that came out back in 94 by Drs. Ramos and Martin, two neurosurgeons who did research on VAX-D back in 94, and this was later published in the Journal of Neurosurgery. As I touch on almost every week on this show, how important this research is, because it's the only research of its kind showing that a non-invasive, non-surgical medical device, and again, there's a lot of people out there advertising things that they say are similar to VAX-D, or they call their treatments state-of-the-art disc treatments. I've heard a lot of different names for a lot of different things. And in many cases, it's not the actual name of the table. It's something they make up to make you believe it's something better or more high-tech. But with VAX-D, again, the proof is in the pudding, as I always state each and every week. The research is supported, and this research was done back in 94 on real-life subjects with pressure sensors, showing that each and every time you undergo VAX-D therapy, pressure is reduced. Interdiscal pressure within the disc, upwards of a negative 200 millimeters of mercury, creating that vacuum effect, reducing the pressure in the disc, creating that vacuum, allowing for the flow of nutrients and oxygen back into that compressed starved disc. And that's typically the problem, the cause of the problem, the structural problem. In many cases, the medication, the physical therapy, the epidurals, even surgery does not address the actual structural cause of the problem, which is the compression on the disc, on the spine. That can lead to degenerative disc disease, starving the disc. VAX-D is able to open that up. And it's been proven when you reduce the interdiscal pressure that allows for the flow of fluid, oxygen, back into that compressed disc. When that disc is compressed, it's being starved of nutrients and oxygen. So it dies quicker than the normal aging process. And it desiccates, degenerates. you see on the MRI the disc turning from white to gray to black much sooner than it should for your age. If you look at your other disc, why are the other discs white or gray? And the discs that are bulging or herniated, the discs that are compressed, why are they dark gray or black? Because they're being starved of nutrients. So we're able to open that up with VAX-D, allow the flow of fluids back in, oxygen, but also we're able to pull the disc material that's pushing on a nerve, causing your sciatic pain, numbness, tingling, weakness, hip, buttocks, groin, leg pain. Take that disc off the nerve, relieving your sciatic pain, your numbness, your tingling, your weakness. If a disc is pushed out and narrowing the canal, central canal, or the holes in which the nerves come out of, foraminal stenosis, central canal stenosis, we can pull that disc out of there and relieve your narrowing or your spinal stenosis. People with failed back surgery, people contemplating surgery, we're able to help them avoid undergoing the knife and all the possible permanent complications that can result from any surgery procedure, infection, bleeding, blood clots, which of course can kill you, but in the case of spinal surgery, scar tissue, which we see very commonly. And the simple fact is when they go in there and snip off a piece of the disc, that's all they're doing. That may take your leg pain away temporarily, but it's not addressing the structural cause, the compression on the disc and on the spine. And it's only a matter of time to those bone spurs that start to form, those stalactites and stalagmites, as I call them, osteophytes, eventually will fuse together. Then you're back to square one again. And guess what? Just like Tiger Woods and just like many thousands of people that have undergone spinal surgery, you got to go back and get another one. Multiple failed surgical conditions, with each subsequent procedure, your rate of success continues to plummet, and the rate of permanent complication continues to rise. So that's why we do this radio show. Hopefully you out there listening will tell your friends, your neighbors, your relatives. That's how we get most of our referrals. We do get some referrals from medical doctors, PCPs, that hear about us and refer to us. But the majority is from people that refer to us, that have gone through the procedures, that know someone has gone through the procedures and have done well. And they're able to avoid the possible permanent complications that you can see each and every day with back and even with neck surgery, with the neck surgical procedures we offer, or the anti-surgical procedures that we offer here. Safe, non-invasive, very well-researched procedures. Again, VAX-D is the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. Again, look at the research. You will see many people make claims, in some cases actually use the VAX-D's research, claiming it to be their own. So again, if someone quotes you VAX-D research and shows you a different table, in many cases they don't even want to tell you what the name of the table is. They make up a name for their procedure, but it's not actually the name of the table. And in many cases, a lot of these guys know that these tables are glorified traction tables. There's no true research supporting that they actually produce negative pressure. They may have some research showing that they've helped some patients. Any traction device, any inversion table can help a few patients. But you need to have the evidence that's actually doing something to affect the disc. So if they show you VAX-D research and show you a different table, don't expect the same results. Due to the unprecedented success of VAX-D with low back pain, there's many copycat glorified decompression traction tables out there quoting VAX-D's research. Beware of these other traditional traction tables that advertise as decompression. VAX-D is a patented technology that's cleared by the FDA. It has published results and proven decompression of the disc, and we see the many, many research studies, including the one I just mentioned, Dr. Ramos and Martin, Journal of Neurosurgery. We've had many studies published in the Journal of Neurological Research, Canadian Journal of Clinical Medicine. This research was actually done right here by Dr. Miskovich, right here at the American Back Centers, and published. Journal of Neurological Research, as we mentioned, multiple studies, Neurological Research Journal. The list goes on and on and on. Anesthesiology research showing that 4 years plus patients undergoing VAX-D still pain-free. So the question that we have all the time is, will this treatment be permanent? And part of the protocol is following our specific protocols here at the American Back Centers. We continue to perfect what we do. Our success rate continues to climb because of that. If accepted for care, you have an over 92% success rate with our treatment if you follow the program. Our program does consist of VAX-D as well as rehab and therapy. And that's a very important component once we get to that point. Again, the rehab and therapy alone does not truly pull the disc back into place or rehydrate the disc. It will help to keep the disc from going back out again by building a strong supporting structure, but at the appropriate time. Many people try to do physical therapy alone for the disc problems, and all it does is in many cases, aggravate the problem because the disc is not being addressed. First, you have to stabilize the disc, get things under control, then you can start building up the supporting structure. In addition, VAX-D does strengthen the disc walls and tighten up the rings that contain the fluid as well. So if you have a torn disc, we can actually heal a tear in a disc with VAX-D as well. But the rehab and the therapy and all the protocol that goes along with it, restricting your activities initially, which we tell you what you can and cannot do, it's all on a worksheet. And we slowly incorporate activities as you improve. We have natural anti-inflammatories. We have a anti-inflammatory diet that we recommend to you as well. We have many, many things that go into our program, and our program is unique. No one does it exactly like we do, and we have a great success rate. Again, our protocol is physician-directed. Our protocol engages other modalities on a case-by-case basis, and we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help you. So if we can't help you, of course, we're going to refer you out. And we have over 20 years of experience treating these type of cases now, one of the most experienced facilities in the country instituting this type of care, definitely the most experienced facility in this area. And that's why for the last 20 years we've been known as Pittsburgh area's disc specialty center. And there's a lot of other so-called disc centers that have been popping up here and there. But again, we have the reputation. We've been doing it the longest. We have the best treatment options out there to help you avoid these type of issues. Whether it's bulging herniated disc, degenerative disc disease, facet syndrome, failed back surgery, sciatica, stenosis, some of the worst cases we've been able to help here at our office here at the American Back Centers. So if you are new to the show, typically that's what we do in the first half hour, talk about VAX-D and how we help. We've helped thousands of patients over the years with these type of problems. In the second half hour, we typically have a nutrition or fitness topic. Last week we talked about, last week we weren't here. I had to take, I didn't have to, but we had a great time. The family went to Kennywood for the day. It was a beautiful day, so we did run a tape last week. But 2 weeks ago, we had a special guest, Jay Miranda, from Healthy Hemp Solutions. So if we have time today, we'll touch on a little bit more about the CBD oil and the cream. We're seeing great results with this. Completely safe. He touched on it if you listened to the show 2 weeks ago. The CBD topical cream is very powerful for pain relief. In some cases, more powerful than some of the other topical creams we have here. The BioFreeze Professional is a great product, but the Level 5 hemp oil is really superior in its pain-relieving properties. We've had patients who were taking very powerful narcotics, and then they tried the Level 5 hemp oil, hemp cream, I should say, topical cream, and it actually worked better. And again, you don't have any side effects. It's completely natural. And then the hemp oil, he touched on some good results with kids with epilepsy, with seizures, tremors, autism. I have a few patients that are using it on their kids for autism, and they're seeing great results. So we'll touch on that more. If you'd like to try the oil or the cream, just call our office, and we can send it to you, or you can pick it up right here at our office, American Back Centers. So this week, though, we're going to touch on natural remedies for prevention of dry eyes. Many people I know this time of the year have dry eyes. So we're going to touch on some of the natural ways you can help prevent dry eyes. If we have time, we'll touch on some of the dangers of flip-flops as well. We talk about with my patients not to wear flip-flops, to wear tennis shoes, especially when you have back pain, because it doesn't support as well. There are some ways you can make your flip-flops better. We'll touch on that as well. We do have those custom-made orthotics. You can actually get the custom-made orthotic built into your flip-flop. And I wear them myself. because I do like to wear flip-flops. Also, I do like to wear barefoot. We'll touch on that, too, either this week or next week, depending on how much time we have, talking about the concept of grounding and how that's important as well. But if you must wear your flip-flops, like I do sometimes, especially if I'm walking around on surfaces where I don't want to step on a nail or something that may get into my foot, there are ways to make your flip-flops safer, especially getting a built-in orthotic, custom-made orthotic built into your flip-flop, which we can do for you as well. We can touch on that as well. And, of course, you can call our office if you have any questions about that. As always, of course, the American Back Centers, we're not your typical chiropractic office. As I mentioned, since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, balding disc, failed back surgery, sciatica, stenosis, and degenerative disc disease. Again, for the last 20 years, we've been known as Pittsburgh area's disc specialty center. We have the best treatment options, a very time-tested treatment, very safe treatment. Used at over 300 facilities worldwide. There's a few hospitals, medical, chiropractic, physical therapy clinics across the country as well as worldwide, as I mentioned, using VAX-D. And there's approximately 3,000 patients a day currently being treated. Yes, 3,000. None of these other, and I have to laugh, some of these other so-called disc treatments, they claim to have 3 offices, they claim to have this, and that. 3,000 a day with VAX-D. Nothing comes close to that. And you can see that medical doctors, orthopedic surgeons use VAX-D in their practice. Physical therapists, all specialties, chiropractic physicians, all specialties use VAX-D. So that should tell you something right there, as opposed to some of the other treatment options out there, only used by a small number of facilities, if that. This, of course, is VAX-D, standing for vertebral axial decompression. So again, as I always ask each and every week, if you're out there listening, you yourself or you know someone who's suffering with severe back or even neck pain, which we'll touch on here in a few moments, which is unresponsive to your current treatment, you want to avoid further pain medication, epidurals, pain shots, physical therapy, even chiropractic in some cases not working for you. You've been told you need surgery. You've already had surgery and it hasn't worked for you. Your symptoms are radiating into your hip, your buttocks, your groin, down your leg, numbness and tingling, weakness, foot drop in many cases. We can help as well. Again, the only way you're going to know is by coming in and talking with us. We do offer a free consultation. I'll tell you how you can do that here in a few moments. So in addition to the vaccines I touch on each and every week, there's over 300 facilities, as I did mention to you, worldwide now. We are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now and into the future. This technology, as I mentioned on this show many times, was invented by Dr. Alan Dyer, who's the former Deputy Minister of Health of Canada. He himself had a disc problem. He saw the problems with back surgery, developed this machine with the help of other doctors and engineers, and put it on the market in the late 80s. And then that groundbreaking research came out in 94, and really VAX-D took off from there. Dr. Dyer also played a part in inventing the heart defibrillator. Of course, we know that's an extremely important invention. So he played a part in the heart defibrillator as well as the VAX-D therapy. So don't wait until your condition worsens. Call us today to schedule your free consultation, 1-888-222-8293. Again, 1-888-222-8293. Again, not 1-800. It's 1-888-222-8293 or 724-935-3300, 724-935-3300. And also, if you'd like to fax over reports, we tell you if you're coming from a great distance, we're more than happy to take a look at your MRI, CT report, X-ray report prior to coming in. If you're coming from hours away, we have people coming from out of state, Ohio, West Virginia, the state of New York, all across PA. Coming many hours. We do have a list of hotels on our website as well, www.AmericanBack.com with an S.com. If you'd like to visit our website, you can request an appointment on the website. You can see a list of overnight lodging on the website. But our fax number, again, is 724-935-3321. I say again because we touch on it each week on the show. 724-935-3321 is the fax number. I encourage you fax over these reports. We can take a look at them. If you want to have it ready for your consultation, if you already have a consultation scheduled, It's nice to have it here. If you can't go pick it up, you can just call the facility where you had it done, ask if they can fax it over, the report, of course, not the films, fax it over to our fax machine, and it's much easier for you, because then we have the report here ready. In many cases, people come in for the consultations, and we don't have the report, we don't have the films, and then it just takes extra time. We have to call the hospital, the facility while you're here, and we have to wait for that to come over. And in many cases, it's essential because we can't really truly accept you as a patient and truly see if you're a good candidate for the therapy until we have all the information. And in many cases, the MRI is critical before we can start therapy in some cases. So again, the fax number is 724-935-3321, 724-935-3321. And really, again, just to expand on that, it's really for your safety more so than anything. There's very few contraindications to this treatment, but we just want to make sure. And we want to make sure you're a good candidate for the therapy as well, because we only accept the people we know are going to do well. We try to help everyone, but we're not going to lie to you. If we don't feel that this therapy is going to work for you, then we are going to refer you out. And we're not going to have you waste your copay, deductible, time, money, if we don't think it's going to work for you. But if it does, if we do think you're a good candidate, we have all the information, you have a documented over 92% success rate, if not higher in many cases, because of the great treatment options we offer here and all the things we do here. Again, our protocols are unique, and no one does it like we do it here, and we continue to get better and better with over 20 years of experience treating these most difficult cases. So in addition to the VAC-C, of course, the VAC-C is a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical GIST treatment out there used by MDs, DCs, orthopedic surgeons, physical therapists worldwide in over 300 facilities. We also offer cervical GIST treatment options if you have a disc problem in the neck region, bulging, herniation, degenerative disc disease, posterior facet syndrome, or even you're contemplating neck surgery. You've already had a failed neck surgery. Give us a call. We've helped thousands of patients with neck issues, radiculopathy, disc problems, failed neck surgery. Again, call us before you undergo the knife. If you've been told you need surgery, you're going to go, you have a surgical consult scheduled, give us a call first. At least give us a try. Most surgeons will even tell you that. Exhaust all your conservative treatment options first before you undergo the knife. The knife is permanent, and you can have permanent complications with surgery. So at the very least, come and talk to us first before you blindly go under the knife. Therapy and rehab, we have state-of-the-art facilities instituting therapy and rehab for all types of cases. Our disc patients have specific rehab programs: neck, back, shoulder, knee, ankle, hand, finger, foot. All these issues are addressed with rehab programs that are individual to your problem, ergonomic, postural issues, looking at what you're doing at work, at home, even in the gym. Also certified personal trainer, so I can help you do all these things and avoid further injury. Wrist, hand, finger, foot, ankle, knee problems, examples including tendonitis, rotator cuff, carpal tunnel, frozen shoulder, plantar fasciitis. The list goes on and on and on of what we can do. Any musculoskeletal issue, we have rehab programs. We institute the rehab, the therapy, the chiropractic adjustments, massage, all under one roof working together, and nutrition as well. Deep tissue massage, myofascial trigger point therapy, acupressure, reflexology, done by licensed massage therapists. Comprehensive nutritional consultations done right here at the American Back Centers. We have a new updated nutritional consult, which we're instituting now, that patients like. Custom-made orthotics, computerized digital scanning, assessing for foot dysfunction. Acupressure, available for general systemic issues. Example, sinus issues we've had great success with, where we do sinus drainage. So if you're having issues with sinus-related issues, we can help you with that as well. In-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Center, so we can do this as well in-house. And we have a convenient MRI facility right across the street that can help you get your MRI, get your CT scan, and in some cases you can get it the same day and walk right across the street with your films, or of course drive across the street, either or. We're that close. And you can we try to squeeze you in the same day and take a look at the film so you don't have to make a special trip out. Again, we have many people coming from hours away. So We make it convenient for you. In many cases, the patient can get that MRI, come right across the street the same day they have the MRI scheduled. We squeeze them in, we put the films up, take a look at it, and then determine if you'd be a candidate for the therapy the same day. So you don't have to make a special trip out here. So again, we're really trying to accommodate the best we can to help you in many ways, because again, we have people coming from a great distance for these unique treatments. So if you'd like to schedule a free consultation at no cost or obligation, this includes discussion of any x-rays or MRIs or CTs you've had in the past. Bring those in. Bring everything you have in. If we need to order another one, we will. Most importantly, we're answering all your questions. We do encourage you to bring somebody with you. Number one, it's always helpful to have somebody drive you out here if you're in pain. That's just common sense. You don't have to have somebody with you. But bring a family member, spouse, friend, neighbor if you can. Answer all your questions. Make sure you have all your questions that you have with you. If you may forget something, it's helpful to have somebody with you. We give you a lot of good information when you come in for the consultation. Also, we're going to do a detailed history, physical exam, look at the films, and then determine if you're a candidate for the therapy. If you are a candidate, we have an over 92% success rate if we accept you for care. So the consultation is open to the VAC-C candidates, the cervical disc treatments candidates, as well as any of the other therapy, chiropractic people that we have coming in, including the LipoLite, which we'll touch on here in a few moments as well. We offer a DVD. This is when Channel 11 WPXI did a medical breakthroughs report on our office. They heard about all the hundreds, if not thousands of people we've been helping with VAC-C. They put us on Channel 11 News, and this is on a free DVD. This is a great way for you to see the VAC-C in action. Dr. Miskovich answers some of the key questions you may have about VAC-C, and there's some great patient testimonials on there as well. In addition to that, we have some research papers we can send out to you. The first paper was published in the Canadian Journal of Clinical Medicine. As I mentioned, this research is done right here at the American Back Center, so we're very proud of this. We have a knife in the back article, again, showing the failures of back surgery and why surgery is not the best approach for chronic back pain, specifically fusion surgery with the rods and the screws, and how they continue to do it despite the fact that it's not successful because they make tons of money off of these fusion surgeries. And finally, we have the blue workers' comp book and the yellow auto accident booklets done by attorneys. And these are great books. They're not going to be soliciting you because they're out in Philadelphia. But they're great books, and they help you avoid the common pitfalls and mistakes that a person who's injured at work or an auto accident or a personal injury case make. And these mistakes will come back to bite you. And you don't know that you're making these mistakes. In some cases, the insurance company or the employer tell you lies, and you believe them of what you can and cannot do because you don't know your rights. So it's important to know your rights so you don't make these common mistakes, which will come back to bite you. So if you know someone who's been hurt at work, you yourself have been hurt at work, auto accident, personal injury, call and get the blue workers' comp book or the yellow auto accident, personal injury booklets. They are free. If you'd like to schedule a consult with us, call us. If you have a workers' comp injury, you've been you lifted something at work, you twisted, you were sitting at work, you went to get up and you had back pain, they diagnosed you with a sprain strain, which they typically do to lower the severity of your condition. You may think you're going to your panel doctors and you may not be doing well. You're not getting anywhere with the therapy. It's not helping you. You may think you have a disc problem, especially if the pain is now going in your butt or down your legs. They're hesitant to order an MRI, which we see very commonly, the workers' comp panel doctors. And you think you have more. You think you may have a disc problem. Give us a call. We can order that MRI. We can see if you have a disc problem, and we can treat you appropriately. In many cases, workers' comp just wants to get you back to work as soon as possible. I hate to say it, but in many cases, it's all about money to them. And they just want to get you back to work so they can take you off the books, per se, so they don't have to pay workers' comp. That happens very commonly. So call us if you're in that situation. We may be able to help you. We have the unique treatments for those type more difficult cases. And, of course, we can order the MRI if need be to assess if you have a more severe condition. Same thing goes with whiplash cases, car accidents, personal injury, slip falls. You may have a more severe condition that needs to be diagnosed appropriately. We can do that for you. We have state-of-the-art rehab, therapy, massage, chiropractic, and specialized disc treatments, because you may develop a disc problem from a car accident, as well as whiplash injuries, and we have the rehab and the best therapy for that right here at the American Back Center. So give us a call. Again, toll-free 1-888-222-8293 or 724-935-3300 to schedule your free consultation. All right, so I'm going to give a couple quick testimonials as I have from time to time. This testimonial goes on to state, I was very cynical that Vaxi would help me, but within a matter of weeks, however, I was out of excruciating pain and had my life back again. It still upsets me that I had to suffer for 2.5 years before finding treatment that actually worked. I can't say enough for the caring professionalism of the staff at the Vaxi Center. The treatment was painless, and I remain pain-free for over a year now. And in most cases, patients are pain-free indefinitely. You can see the before and after. I'm just looking at this 24-page booklet, which we can send out to you, Keller booklet, describing the ins and outs of Vaxi. Of course, we can send it out. We typically send it out with the video, the DVD, Channel 11 video. If you want information on Vaxi, some people want some information before they schedule a consultation, and that's perfectly fine. They have a great before and after picture. We have before and after pictures of pre-treatment MRIs showing the severe herniation, degenerative disc disease, straightening due to spasm of the lumbar spine, and then post-treatment, the total retraction, rehydration of the disc, and improvement in the lordotic curvature post-Vaxi treatment via the MRI. So some amazing results that we see day in, day out with this wonderful treatment, Vaxi, and we see it in the proof is in the pudding with the research as well as the pre- and post-MRI showing conclusively that the Vaxi does what it says it does. And it's a remarkable treatment that works, and we've helped people for over 20 years here at the American Back Centers locally avoid these type of problems with Vaxi therapy. Finally, one medical doctor, Dr. Bailey, goes on to state, this is from a medical director in the Georgia Spine and Pain Institute, I had epidural steroid injections as well as having surgery suggested. However, after 1 week of Vaxi, the excruciating leg pain I was experiencing was gone. After a month of treatment, I had a few months of simple exercises. I was back to jogging and other strenuous activity. We have never had a real answer to disc-related low back disorders at our clinics. Now we do. This is from a Dr. Bailey, MD, who is the president and medical director of Georgia Spine and Pain Institute. So, medical doctors, orthopedic surgeons, chiropractic physicians, physical therapists all see the research and the success with this remarkable treatment called Vaxi. So again, as always, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks you see with any surgery, infection, bleeding, blood clots, which can lead to death in many cases, unfortunately, when Vaxi is an option. Remember, Vaxi is a non-invasive treatment with a much, much higher success rate than surgery, pain injections, or even physical therapy. Many patients go this route and eventually end up at our office wishing they would have come much sooner. Remember, Vaxi addresses the structural issues, not just the symptoms. Truly decompressing the disc, restoring the fluid content to that compressed, desiccated disc, taking the compression off the spine of the disc, pulling that disc material back into place, off the nerve, relieving your sciatic pain, your stenosis, numbness and tingling, weakness, pain, foot drop, herniated, degenerated disc, and even failed back surgery cases. And, of course, we have cervical treatments for the neck, disc problems as well, which we've touched on as well on this show. All right, before we get into the second segment of the show, the nutrition segment today, I do want to remind you, if you do have any questions whatsoever, we do have open phone lines, 412-825-6262, 412-825-6262. I want to thank Jay Miranda for being on 2 weeks ago from Healthy Hemp Solutions as our special guest. We were touching on the CBD hemp oil and all the amazing things that this so-called controversial product is seeing in kids, autism, epilepsy, as well as adults with pain. And a lot of people, when they think about cannabis, they think it's taboo. It's a bad thing. They think about marijuana, they think about potheads, but it's not that. It's completely safe. You're not getting high from this product. There's no THC, very little, if any, in these products. It's all the CBD and that's the product that makes a positive impact on your health and well-being. It does not cause a high. It's a much safer, less controversial alternative, which has significant health benefits. CBD is well known for its wellness properties and its capacity to offer ease and relaxation. Unlike medical marijuana products, which are usually made from plants with high concentrations of THC, CBD oil is made from high CBD and low THC hemp. This hemp contains only trace amounts of THC, and these are great products for pain. Amongst other things, we touched on the Charlotte's Web oil that you put on your tongue. They're seeing results with autism, epilepsy with seizures, as well as tremors, and Parkinson patients as well. It's legal in all 50 states and completely natural. So if you'd like to try these products, of course, call our office, 724-935-3300, and we can tell you how you can get them. We can send them to you. You can pick them up right here at the American Back Centers. If you're looking for the best all-in-one liquid multivitamin, the Intramax is what we have here, and it's what I recommend. I take it myself. It's really the best one out there. It has the peer-reviewed research showing the effectiveness of the product, so they back what they claim with research. 415 different ingredients in 1 ounce of Intramax. So this is the adult multivitamin. There's the Intra-Kid for the kids. All-in-one liquid. Again, the liquid. You're taking a liquid instead of taking a big horse pill. Nothing synthetic like your Centrums, your One-A-Days, your Walmart, your Costco vitamins in many cases. 100% natural. No allergens whatsoever. Liquid product that you're absorbing. Much easier on the digestive tract, so you're not having to worry about not digesting this product. All natural, no preservatives, drug-free, hypoallergenic, completely natural product, 100% carbon-bound organic product, extremely high ORC rating, nutrient value in this product, Intramax. So we can offer it to you for free shipping on your first bottle or $5 off if you pick it up here at the office. To save you a little bit on your first bottle, because we're so confident you're going to love it, and it's going to make a difference in your body. And it's made a difference for me, and really the best starting point for any nutrition program is a multivitamin, and this is the best one. It's called Intramax, and the Intra-Kid for the kids. So call us today to try it. Also, as we mentioned, we talked about the CBD oil and the cream. In addition, we have the L-arginine Complete if you're looking for a nice product for nitric oxide production, which is a very important nutrient. Some say one of the most important nutrients as we age for keeping the inner body healthy. And L-arginine with L-citrulline. Also, there's vitamin D and vitamin K2 in balanced amounts. We touched on the importance of calcium absorption and making sure that calcium does not go in the bones. It's all in this product, in addition to the homocysteine, B6, B12, folic acid, all in this powdered product. You scoop it out and put it into a glass of water, stir it up. Basically, it becomes liquid, and it's highly absorbed and easy on the digestive tract. Wonderful product. Nothing unnatural in this product, only sweetened with stevia. Highly recommend this product. If you're lacking energy, you have high blood pressure, neuropathy issues, poor circulation, poor sexual performance, lack of endurance, fatigue. This is a great product for inducing more nitric oxide production, which causes, lack of nitric oxide causes those symptoms I just mentioned. So call our office, we can send it to you, or we can pick it up right here at our office. Also, we have the LipoLite procedure. If you're looking for a way to slim shape or tone, you want to lose a dress size. If you're a male, you want to lose a shirt size. Completely safe using the power of light therapy. Causes fatty acids to be broken down and released, tightening the collagen and elastin fibers to tone and tighten your skin, stretch marks, a little jiggle, love handles in the arms. If you have love handles, these are perfect areas. And just about every patient, if not all patients, have seen some results, whether it's 1 to 2 inches, 3 inches, 4 inches, with any treatment protocol. 6 to 12 treatments is typically what we recommend, and you see results, and it's completely safe. Call and ask us about the LipoLite procedure. Before we get into the nutrition segment today, if you'd like to sign up for our daily health update newsletter, it's sent out once a day. It's a short one-page health tips with a quote for the day. And this quote is updated each and every day, of course, and the health tips are updated each and every day. It's sent to your email free of charge. So just go to our webpage, www.AmericanBackCenters.com. Look for the Daily Health Update newsletter. Sign up for that. You automatically get signed up free of charge for the monthly In Good Hands newsletter. This is some of the greatest minds in the country contributing to this. Cleveland Clinic, as well as people from Dr. Oz and the Doctor Show, contributing to this monthly In Good Hands newsletter. That comes out once a month. It's usually about 10 pages. The daily is just one short page. You can get health tips each and every day, free of charge. Go to our website, sign up for it today, www.AmericanBackCenters.com. All right, we're going to switch gears, get into the natural remedies for prevention of dry eyes. This is from Mercola.com, MERCOLA.com. You can also find most of our health articles we touch on, if not all, because I've been doing it almost the last year now, on our Facebook page. So if you visit our Facebook page, if you have Facebook, go to American Back Centers Pittsburgh. Again, American Back Centers Pittsburgh is our Facebook page. Take a second to like our page. Just takes a second to do that. If you want to follow us, friend us, you can do that as well. But the health articles are right on that page. So as long as you have a computer and a printer, print it off. We ask only if you don't have a computer and printer, we can send it to you free of charge just to save on posting. Otherwise, we have hundreds of people calling us for this information, and we're more than happy to send it out to you free of charge if you don't have a computer and printer or access to the Facebook page or Mercola.com, MERCOLA.com. The article is entitled Natural Remedies for Prevention of Dry Eyes. So we go on to state, although many accept declining eyesight as a part of natural aging, it's really more of a side effect of modern lifestyle. Aging does not automatically equate to failing vision, cataracts, or dry eyes, provided you properly nourish your eyes through the years. Unfortunately, stats demonstrate that many Americans are suffering the effects of years of poor lifestyle choices. In people over the age of 40, 24.4 million people have cataract. 2.7 million have glaucoma. 4.2 million suffer impaired vision. 4.88 million suffer dry eyes. The risk of developing dry eye increases with age, and women appear to suffer from the condition more than men. You may have experienced some of the symptoms of dry eye after having been outside in windy conditions or a long day wearing contact lenses. And I've noticed that, especially when I lived in Chicago, when I went to graduate school, they don't call it the Windy City for nothing. And I of course, have contact lenses. And it's, in my opinion, a horrible city to live in if you have contact lenses because you got wind blowing all the time, especially in the winter. And I constantly had dry eyes. And I didn't know about these recommendations at that point, but now I do. So we're going to touch on some of the recommendations, natural remedies for prevention of dry eyes here in a few moments. So these symptoms may include a scratchy sensation over the eye or feeling as there's something in your eye. You may feel as your eyelids are heavy, be more difficult to blink, or you may experience blurred vision, any of these symptoms. The medical term for dry eye is keratoconjunctivitis, CICA. Left untreated, the condition may lead to serious damage to your eyes. In the past, dry eye was treated by adding moisture, such as a normal saline drop. Today, there's a better understanding of the complexity of some of the substances in your tears and how they function in your eye. So the next paragraph is entitled 3 Layers to a Teardrop. There are several layers to your tears your eyes produce naturally. There's up to 1,500 proteins. Tears can actually be a complex mixture of mucus, fat water, fatty oils, and different proteins designed to keep your surface of your eyes smooth and protected from environmental pathogens and irritants. You have 3 different types of tears, and each has a different chemical mix produced by 3 different glands. These glands produce an outer oily layer that keeps your tears from evaporating too quickly, thus enabling the tears to remain on your eye and protect your organ. Other glands produce the middle layer of watery tears and water-soluble proteins that help to nourish the cornea, as well as the mucous membranes covering the entire front of the eye and the inside of the eyelids. Goblet cells produce the innermost mucin layer of tears and the glycoprotein components of mucus. Thus, This binds the water from the aqueous layer produced by the lacrimal glands to ensure your eye remains wet. When your eye is healthy, a continuous bath of tears will cover and protect your cornea. This is the clear dome-shaped outer surface of the eye over the pupil. Every time you blink, these basal tears nourish the cells of the cornea. The second type of tear is called the reflex tears. These are produced in reflex to an irritant in the eye or exposure to external irritants such as wind, smoke, or onions. The third type of tear is one you may be most familiar with, emotional tears. These are produced after a powerful emotional stimulus and may have higher amounts of proteins than other tears. The process produces approximately 1.2 milliliters of tears each day and half a liter each year. When insufficient tears are produced or the composition changes, it can affect both the health of the eye and your vision. Eyesight might be affected by adequate amounts of tears on the surface of the eye and affect how your eye focuses light and color. Next paragraph, your tears serve several functions. One function of the tears is to keep your eyes moist and functioning optimally. When your eyes become dry, the inner eye that covers the eye and inside of the eyelids become very dry. This is a condition called keratone conjunctivitis sicca. Tears serve other functions as well. Emotion or weeping, tears are formed when you experience great joy or sorrow. Actually, any powerful emotional response may generate tears, including anger. Women often cry more than men. According to one estimate, women cry on average 5.3 times per month, compared to men who cry 1.4 times per month. However, the gender differences may also be related to cultural differences, as Western cultures give greater freedom to women than do men that cry. The emotional shedding of tear has healing powers as it helps to release powerful emotional triggers, including stress, anger, sadness, grief, and joy. These emotional tears also actually contain stress hormones and other toxins that accumulate during stress. Crying also stimulates your body to produce endorphins, the feel-good hormones that help balance your emotional state. When your emotion or situational problem persists, crying may help you feel better and improve your decisions about the situation. So crying is a good thing, and you see why. What triggers dry eyes? Dry eyes can result from an immediate environmental stimulus, such as a windy day, or can turn into a chronic condition if there's a problem with your tear duct glands or ducts. Two main types of chronic dry eye. Number one is deficiency, triggered by inadequate production of tear volume. Evaporation, more common. This condition is triggered by acceleration of tear evaporation due to poor quality tear production. There's conditions that affect both the quality of the tears you produce and the amount of tears that are produced. Health conditions may trigger one or two reasons why chronic dry eyes include LASIK surgery. So if you've had laser eye surgery, this may affect how your body, the quality of the tears, and how your body produces the amount of tears produced. Hormonal changes during pregnancy. So if you're pregnant or going through menopause, you may have issues with tear and dry eye. Sjogren's syndrome, rosacea, lupus, scleroderma, diabetes, rheumatoid arthritis, thyroid disorders, and vitamin A deficiency. Environmental conditions that contribute to the development of situational dry eye include wind, smoke, medications such as decongestants, which will dry your eyes, antihistamines, of course, will definitely dry, antidepressants, hormonal replacement therapy, birth control pills, medications for anxiety, Parkinson's disease medication, and high blood pressure medication. Seasonal allergies can also contribute to situational dry eye. Prolonged periods without blinking, extended periods at the computer or staring at your cell phone can contribute to dry eye. Most people report symptoms such as feeling of gritty sensation in the eye during blinking or photosensitivity, sensitivity to light. You may experience blurred vision as your tears help focus light, or feel eye strain or fatigue from constant straining to see clearly. These symptoms usually fluctuate during the day as the amount of tear production or quality of the tears may vary. Some of the possible complications. Now we get to the complications now with dry eye, especially long-term dry eye. Your eyes thrive in a moist environment, so depriving the eye of moisture may lead to significant complications. Without a moist level of tears to protect your eye, you're open to a greater number of infections. These infections can result in inflammation of the conjuncta that covers the eye and in the inside of the eyelids. However, this inflammation, known as conjunctivitis, does not only occur with infection, it may be triggered with lack of moisture on the eye alone. So if you have chronic dry eyes, you could make yourself more prone to eye inflammation as well as infections. Left untreated, dry eye may increase the number of corneal abrasions and ulcerations in the cornea and may lead to deterioration of your vision. Ulceration of the cornea is called keratitis, which may lead to permanent scarring. So here are some natural strategies to help you prevent dry eyes in the first place. While recommending treatments may include tear-stimulating drugs, artificial tears, or eye drops to control the inflammation caused by dry eye, like other health conditions, prevention is your best medicine. If you currently have dry eye, you want to incorporate these strategies while slowly weaning off your current medications with your physician to reduce the risk of complications. The following strategies may help you prevent problems with reduced tear production or poor quality tears, or help reverse your current pattern. Use them while reducing the environmental factors that increase your dry eye discussed below. So number one is a product called NAC. It's a derivative of the amino acid L-cysteine. NAC has antioxidant properties, is widely used to reduce the viscosity of secretions in bronchial pulmonary disorders. Ophthalmologists use this to treat corneal abrasions and ulcers in dry eye. So again, NAC, a nice product that's natural. It increases the production of glutathione, the principal antioxidant for the eyes, protecting against oxidative damage. Number two, omega-3s. Your body begins using omega-3 fats, fish oil, before you're born to help develop your vision. Those benefits continue through adulthood. The omega-3 may be a useful remedy for dry eye. In a study for more than 415 participants, a daily dose of EPA, 360 milligrams of EPA and 240 DHA, helped reduce the symptoms of dry eye in people whose condition was aggravated by computer use. At the end of the 3-month trial, the individuals taking the omega-3 supplement enjoyed significantly fewer symptoms and reduced abnormal tear evaporation. So if you're staring at a computer, if you're driving in a car, staring out the window, driving, you're staring at your cell phone all day, that may be something you may want to look at. Increased omega-3 intake for the reduction of dry eye. You can boost your omega-3 by eating more wild-caught salmon, sardines, anchovies, or taking a fish oil supplement. Next product is astaxanthin. It's a carotenoid produced by a form of microalgae. This pigment is used in algae to protect itself from the environment when the water begins to dry up. This is found naturally in salmon, which giving its salmon its colors, shrimp, lobster, and crab their pink coloring. The highest concentration is found in the muscle of the wild-caught salmon again. Another reason to eat wild-caught salmon, which biologists believe that the fish gives the fish their endurance. They need to swim long distances upstream. It's a powerful antioxidant that helps protect your eyes, as well as to prevent unstable molecules from damaging cells and boost your immune system by increasing the number and activity of the macrophages in the T cells. Also helps to protect against macular degeneration, blindness, and cataracts. Also, light therapy and eyelid massage. Using a technique called intrapulse light therapy, followed by massage of the eyelids, helped 87% of people in a study with severe dry eyes to experience reduced symptoms. Next, recommendation, vigorous exercise. This is according to a Dr. Dana, who's a professor at Harvard Medical School. Quote, a lot of evidence supports the benefits of rigorous exercise. It fosters blood flow, helps regenerate tissues, and increases heat, promoting the release of oils in the eyes. So next paragraph, reducing environmental factors that increase dry eyes. Environmental factors include that reduce situational dry eye and may aggravate chronic dry eye. Although simple, the end results may improve your quality of life and reduce the daily discomfort. Tears are spread over the eyes as you blink, so activities that increase the time between blinking may aggravate your symptoms, such as sitting at a computer, staring at a cell phone. Cutting back on screen time and taking breaks to rest your eyes. Wearing blue blocking glasses in the evenings reduces eye strain and may help reduce the production of melatonin, increase your production, I should say, of melatonin before you sleep. Turning down those LEDs, turning off the lights when it's getting closer to bedtime, turning off the TV in the bedroom. Closing your eyes for a couple of minutes or blinking repeatedly will help distribute your basal tear layer more evenly across your eyes. Quit smoking. Eliminating exposure to secondhand smoke will help reduce symptoms, because smoke will dry eyes. Wraparound sunglasses help protect against the wind. Wearing tight-fitting goggles when you swim in fresh or salt water, so the water doesn't dry out. The chlorine in the salt water does not dry out your eyes. Using or eliminating your use of contact lenses. Sitting high on your computer so you're looking down on the screen to minimize exposure on your eye surface. Adjusting the airflow from air conditioners and fans so they don't blow directly on your face. All right, just looking at the time, we are short on time here now, so we're going to have to finish up here. So next week we'll touch on this and summarize this article. We'll also get into the dangers of flip-flops, and we'll touch on how you can actually use your flip-flops by possibly getting orthotics built into your shoe as well on next week's show. So we'll leave you, as we always do, with some final closing thoughts, as always. Why would you even consider surgery when VAC-C is available? We touched on VAC-C today and how it's helped thousands of people right here at our office, the American Back Centers. Please be smart. Remember, surgery is a permanent procedure with possible permanent complications. A smart, educated person who regularly listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of Back Talk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.